Hello, I'm Dr. Ken Landa. Let's talk about Propecia. Propecia is 1 milligram of finasteride, and it's used to treat and prevent male pattern hair loss. It was originally marketed in 1997. The patent expired in 2013, and the price went down. The same drug, but at a 5 milligram concentration, was marketed in 1992 for benign enlargement of the prostate. The idea of using some kind of a drug for treating hair loss in the modern era sort of started in 1942. In 1942, it was found that castrating boys prior to the time of puberty would cause them to have full head of hair throughout their entire life. They did not develop male pattern alopecia. Then in 1974, Cornell University doctor presented a paper on intersex Caribbean children who had sexually ambiguous genitalia at birth. Originally they were raised as girls, but when they went through puberty they developed a penis and the secondary sexual characteristics of males. What was the problem? The problem turned out to be the lack of an enzyme known as 5-alpha reductase. 5-alpha reductase is very important because it converts testosterone, that basically is inactive, into dihydrotestosterone. That is the active form in adults, and that is the active form that causes both male pattern hair loss and enlargement of the prostate. And those individuals that we're talking about, they did not develop male pattern hair loss, and they also had small prostates. Well, the idea was taken by Merck, one of the major drug manufacturers, and they brought out an enzyme, a drug rather, to inhibit the enzyme known as 5-alpha reductase. The 5-alpha reductase, remember, takes the testosterone and makes it into the active form of the male hormone, the dihydrotestosterone. So we know that finasteride, or Propecia or Proscar, is an anti-androgen. It decreases the androgen signaling in the various tissues. Now it's important as you go through puberty to have this particular enzyme because it activates the testosterone, causes the dihydrotestosterone. That's what's responsible for the change in the penis and the testes and the scrotum and the prostate. That's what causes the pelvic and the body hair changes of being a male. Well, the 5-alpha reductase comes in several unique varieties. There's the type 1 enzyme that's in the sebaceous glands and in the liver. Counts for about 1/3 of all the circulating dihydrotestosterone in the system. The type 2 enzyme is in the hair follicles and in the prostate, and also the seminal vesicles in the liver. It's responsible for about 2/3 of all of the circulating dihydrotestosterone, and the Propecia is 100 times more potent here than it is against the type 1 enzyme. There also is a type 3 enzyme. Nobody's exactly certain what it does. Well, it appears you don't need all that much of the Propecia or the finasteride to decrease the dihydrotestosterone in the system. Even at a dose, a fraction, a tiny fraction of a milligram, you're going to be able to reduce the dihydrotestosterone by about 50%. If you use the dose in Propecia, the 1 milligram, you can reduce the circulating dihydrotestosterone by about 60%. Well, if we look at what's happening in the hair follicle, we find that just 1 milligram of Propecia is going to be able to decrease the amount of dihydrotestosterone in the scalp hair follicles by about 60%. Now, the testosterone level is going to increase a little bit, but it still stays within the normal limit. And remember, it has to be activated. And it's not being activated because we're blocking the enzyme that allows it to be activated. There is another drug, and it's known as Avodart. It inhibits both the type 1 and the type 2 enzyme, but it doesn't seem to result in any clinical difference from the Propecia. Now, if we look at androgenic alopecia, or male pattern alopecia, it tends to begin with loss or recession of the frontal hairline and loss at the crown. It begins in the late teens, early 20s, and it's progressive throughout life. It occurs to some extent in all men, and that dihydrotestosterone is required for the miniaturization of the hair follicles. Well, the British Medical Association warns that there are an awful lot of preparations that are being marketed to reverse hair loss for which there's no evidence of their benefit. There are two licensed products by the FDA at the current time. One is minoxidil, originally marketed as Rogaine, and the other is Finasteride or Propecia. It's marketed at 1 milligram dose and actually seems to be as potent as the 5 milligram dose. So it doesn't seem to make any difference which dose a person takes. Well, if we look at people between the ages of 18 and 41, not older, but 18 to 41, and give them 1 milligram of Propecia every day, follow them for a year or two, what are we going to find? Well, if we look at either maintenance of the hair or increase in the hair count, by 1 year, 80% of the men are going to have, if we look at the vertex, either maintained or increased the amount of hair they have. And if we look at the frontal hairline, about 70% of men are going to fall into that category. If we go and look at 2 years, and now we look at the vertex, the crown of the scalp, 60% are going to maintain or increase the amount of hair, and the frontal hairline about 40%. So that's pretty good. And if we look at pictures that we give to observers who don't know which medicine the person was taking, we're going to find that 1 year, about 50% improvement in the group receiving the Propecia, as opposed to only about 7% in the group receiving the placebo. And by 2 years, it would appear that 2/3, about 67% of men, going to have some benefit if they take the Propecia. Now, the likelihood of no change at 1 year and at 5 years is going to be about 40%. So that means somewhere around 50% of men going to have some improvement. Well, how much improvement? If we look at 1 square centimeter, let's look at 1 square inch. 1 square inch. And if we look at the amount of hair that is going to be present, we're going to find the density, because of the Propecia, has increased by about 11%. In the placebo group, it decreases by about 3%. And if we look at the men who lost hair at 2 years, among the men given the placebo, about 70% going to continue to lose hair. In the group receiving the Finasteride, the Propecia, only 17% going to continue to lose hair. Now, the hair count stabilizes between 1 and 2 years. After 2 years, there is no added benefit. No benefit in year 3 or year 4 or year 5. It's stable. So if we look in another study at looking at an inch of hair, inch of scalp, we find the average at the crown is going to be increased by about 91 hairs. Now, the number of hairs overall in a square inch of scalp is anywhere between 800 and 2,200. Average scalp has about 100,000 hairs. So overall, finasteride is going to maintain its benefits on a long-term basis in about 90% of cases, as opposed to about 75% who are receiving placebo, who are going to lose their hair. Now, if we look at the change in the vertex, remember I said about 91 extra hairs, that's in Caucasians. In Hispanics, it's a little less than 70 extra hairs per square inch. If we look at African Americans, or if we look at Asians, it's only going to be about 50 extra hairs. If we go out to 5 years in one study and look at the vertex, well, among the people who were receiving the placebo, they're going to have a loss of about 240 hairs, as opposed to the men receiving the Propecia, will they have an increase of about 35 hairs. We survey the men to see if they're happy or not happy, and at the end of 1 year, about half of the men are happy with the results that they get from the Propecia, and about 20% are dissatisfied. The remainder really have no opinion. If you stop taking the Propecia, the benefits are going to dissolve within a period of about a year. Now, the interesting thought is, what will this do in postmenopausal women? Postmenopausal women tend to lose hair. So could we benefit those postmenopausal women? The answer is no. The Propecia does not work in postmenopausal women to maintain their hair growth. However, if a woman develops a condition of hyperandrogenism, has excess male hormone, then it would appear that the Propecia, by 2 years, is able to decrease some of the excessive hair, if we look at the facial hair, by 93%, the body hair by about 73%. Well, the good news is that Finasteride, or Propecia, doesn't seem to have any significant drug interactions. As far as kidneys are concerned, it doesn't make any difference if you have normal kidney function or somewhat reduced kidney function. Liver disease makes a difference because it's metabolized in the liver. You can take the drug with or without food. The half-life in the system is about 5 to 6 hours. In people who are under age 50, people who are over age 70, it's about 8 hours. It's eliminated by the liver, and it's passed out about 60% in the stool, about 40% in the urine. No problem with overdoses of the medicine. The problem, though, is with women. Women should not touch the tablets, especially if they're broken or crushed, because if they are pregnant or if they're about to become pregnant, it seems that the enzyme, or the inhibitor of the enzyme, the inhibition of 5-alpha reductase, may cause some problems with the external genitalia in their unborn children. May cause a condition known as hypospadias. And the hypospadias develops in 4 to 100% of laboratory animals and happens in humans. This is a condition where the end of the urethra doesn't end at the tip of the penis, but rather occurs on the undersurface of the penis. So very small amounts of Finasteride or Propecia, inappropriate for women who are pregnant to even touch. And as a matter of fact, the Food and Drug Administration says that if you're taking the drug for prostate reasons or for hair, then you should delay donating blood or plasma for at least a month after you've stopped the drug. Side effects are basically the same as placebo. There was a question for a while about whether it might increase the incidence of breast cancer in men. The answer is no. It has a very small increase in the likelihood of sexual dysfunction, either erectile dysfunction or problems with libido, ejaculatory disorders, or even a decrease in the volume of the ejaculate. If we evaluate men, there was a question about whether it would decrease the sperm motility or decrease the appearance of the sperm, alter the appearance of the sperm, decrease the sperm count. And it was found probably not, or if it did, it was really to a minimal amount. And all of those sexual problems appear to disappear, even though men continue to take the drug, or for the most part in men who discontinue the drug. There is a question about whether there's a post-finasteride syndrome, whether you can have some of the sexual problems persist even after you've stopped the medicine. It's very slight if it happens at all. There are a lot of people who complain of issues, but we can't tell the difference between those men and men taking placebo. Now, there's another issue. There was some early reports of whether it would increase the incidence of aggressive prostate cancer. Well, we know that prostate cancer is extraordinarily common, and we know that the Finasteride, either as Propecia or Proscar, is going to decrease the PSA. So some people say, well, geez, the PSA is much lower. Well, yeah, it is much lower, but get a new baseline. Actually, the Propecia is going to reduce the PSA by about a third. The Proscar is going to reduce the PSA by about a half. And the likelihood of the drug causing a more aggressive form of prostate cancer has been shown not to be the case. It's been shown not to be the case, not by the drug manufacturer, but by the federal government, by a big study that involved an enormous number of men. No drug company involvement. So that's pretty good. So we know that the drug appears to be safe. We know that it appears to function relatively well, not for everybody, but it can certainly decrease the amount of hair loss and even cause some amount of hair regrowth. And the other good news is now that it's generic, it's relatively inexpensive. And with a coupon, you can get it for less than $20 a month. So, bottom line, the drug works fairly well. You can rest assured that we don't have any major problems that appear to be associated with it. And the drug also is useful, same drug as in Propecia, for men who have symptoms of benign enlargement of the prostate. You want to know more about the proscar? You have a video on that one too. Thanks for watching. I'm Dr. Ken Landau.